AEDs. This is probably the simplest and easiest section that we'll have in this class. But one of the most important AEDs, this will be specific to front country for your training. And the reason is because the only time you would have an AED in the back country is if you were part of some sort of rescue team, in which case you would have more training than this class anyways. So this is a short section, and the reason is because it's a relatively simple, because the AED machine walks you quite a bit through the process and what you're going to be doing, and actually vocalizes what your next move is as a rescuer. However simple it might be, and however simple AEDs may have made their usage, it's important to know how many lives AEDs save. In fact, we talked a little bit in the CPR section of this class when we talked about heart attacks versus other things that can happen with your heart. Sometimes we could be sent into some sort of defibrillation, afibrillation. If that's the case, sometimes the heart is beating so quickly that we can't pick up a pulse. And so an AED can send an electrical impulse through the body and kind of reset the heart, something that simple CPR cannot do. So like I said, although it's a simple section as far as this class is concerned, the skill set is important, and we also don't want to we want to be able to be calm when we get ourselves into a rescue situation. So let's go ahead and start with a video about overall what AEDs are.
For someone in cardiac arrest, calling 911 or the designated emergency number, starting CPR immediately, and using an AED as soon as possible gives the person the best chance for survival. Cardiac arrest can occur when the electrical impulses that cause the heart to contract rhythmically become abnormal, disorganized, and chaotic. The heart will stop beating or beat too ineffectively to circulate blood to the brain and other vital organs. Two abnormal heart rhythms in particular, ventricular fibrillation and ventricular tachycardia, can often be corrected by defibrillation, the electrical shock delivered by an AED. When effective, the shock disrupts the abnormal electrical activity long enough to allow the heart to spontaneously develop an effective rhythm on its own. An AED is simple to use. The device will guide you every step of the way. AEDs can be used on people of all ages and can also be used on pregnant women. All you need to do is turn the device on and follow the voice and visual prompts. Remember, start CPR immediately and use an AED as soon as possible. For each minute that CPR and AED use are delayed, the person's chance of survival is reduced by about 10%.
So a few things about AEDs that wasn't covered in that video. First is going to be that some AED kits are going to come with one set of pads or two sets of pads. So what you'll notice is that this first set is specific for children. This is what the bottom picture here is what you're more commonly going to see, which is something that is used for both adults and children. And so the really nice thing about AEDs is that they show us, they're really good about pictures and coaching us through what we need to do, okay? So what you'll notice is that for an adult, you place the pads in special places on the chest. So the upper right and the lower left side of the chest. So you would place these pads exactly where you see on the pictures. And for a child, an infant, or a child who's 55 pounds or less, is going to have one on the middle of the chest and one in the middle of the back, okay, of these pads. And so just making sure that you're paying attention to where these pads go. You'll notice that there is an 8-year age limit or a 55 pounds. So you're using this right as a range, best guess based on the information that you have accessible to you. So we have another video here on how to use AEDs.
When a person is in cardiac arrest, use of an AED can help restore a normal heartbeat. If you are the only trained responder on the scene, turn on the AED as soon as it is available and follow the voice prompts.
Chest.
Once the AED is turned on, remove all clothing covering the chest and wipe the chest dry if necessary.
Attach pads firmly to person's chest as shown.
Using the appropriate sized pads, place one pad on the upper right side of the chest and the other on the lower left side of the chest below the armpit. Remember, you should not use the pediatric AED pads or key on anyone older than 8 years or weighing more than 55 pounds. However, adult AED pads can be used on a child if pediatric AED pads are not available. If the pads touch, which is usually the case with small children and infants, place one pad in the middle of the chest and the other pad on the back, between the shoulder blades. Plug the pad connector cable into the AED if necessary and prepare to let the AED analyze the heart's rhythm. Make sure no one, including you, is touching the person. Say, "Clear,"
Clear.
in a loud, commanding voice. Be ready to deliver a shock if the AED determines one is needed. To do this, make sure no one, including you, is touching the person. Again, say, "Clear," in a loud, commanding voice. Push the shock button to deliver the shock.
Shock delivered.
After the AED delivers the shock, or if no shock is advised, immediately begin CPR starting with compressions. Continue giving CPR and following the AED's prompts until you see an obvious sign of life or EMS personnel arrive. If there are 2 or more responders, the steps will be slightly different. Responder 1 will continue CPR, while Responder 2 sets up the AED. When the AED prompts analyzing heart rhythm, Responder 2 says, "Clear."
Clear.
Then the responders switch roles. Responder 1 will now operate the AED, and Responder 2 will now provide CPR. The responder should switch roles in this manner each time the AED analyzes the heart rhythm. Notice how CPR and AED use are working together as parts of the cardiac chain of survival. When CPR is not interrupted to prepare the AED, chances of survival are increased.
So a few things to touch on about 2 or more responders. As far as your assignment for this class, I recommend watching that video that we just watched again. It is in your intro section of your intro file of your module. And so use this as a reference. But a few things, like I said, about 2 or more responders that we don't want to forget to do is that both responders need to identify themselves as being trained, just like we talked about in CPR last week. It's important that you designate certain people for their roles, right? Because like we said, we want to be as efficient as possible, because every minute that we go without CPR or without an AED is 10% decrease in that person's survival, right? So it's super important to have people have those designated roles. So whoever the first person is starts CPR, and the second person, that second responder, is going to call 911, get them on their way, and start getting the AED ready. Okay, so that's placing the pads, that's turning it on, that's doing everything and following along, so that way we have compressions as well as the getting the AED started. Okay, the first responder does not stop CPR until we need to stand clear for the AED to analyze the heart rhythm. One more thing to remember is that we want to be switching roles, just as if we had two-person CPR. And the reason is it's a lot more exhausting and we can go a lot longer, right? It's a lot more exhausting if the same person is doing CPR the whole time. So the perfect time to switch during the AED is when the AED is delivering shock. We have to stand clear, at which case we will reverse roles when we start treatment again, okay? If it says no shock advised, we would still switch roles because it required us to take turns. If you need to give CPR and do not need to give shock, then you are going to do 2 rounds of CPR each and always switch on rescue breaths. Okay, so a few things here. Like I already mentioned, we're going to minimize interruptions in chest compressions and treatment with two trained people. And then we're also going to reduce responder fatigue. So just remembering those key points, as they'll be something that you can be tested on. Finally, there's AEDs in lots of places all around town. So I recommend, now that you're going to have this certification, that you download the app Pulse Point. And when you have that, it'll show you this awesome map here where it'll show you where all AEDs are. It's also strongly recommended that wherever you frequent, that you know where AEDs are located. So whether that's at work or whether that is a place that you hang out or spend a lot of time, you want to know where that AED is. So sorry that my dog barked in the middle of this lecture, but let me know if you have any questions and use these resources to complete your assignments for this section.